working on. Let me give you 9 reasons why private insurance companies would fail with the public option. And this is the real core of the bill. Because if the public option is the only one standing at the end, that means we're in a single-payer system similar to Canada. Are you with me? The President has said on many occasions that if you like your health insurance policy, then you should be able to keep it. If you like the VA, Medicare, etc., you should be able to keep it. First of all, under Section 102, private individual plans are grandfathered and cannot enroll any new insurers except dependents after January 1st of 2003. Well, how can an insurance company stay in business if it can't add any new insurers? Just think about that. Second of all, under Section 161, a private plan must remit to the insured any excess of premium payments minus what the insurance pays out in terms of claims. That means to participate in this health exchange, you cannot have an insurance company that shows any profits. I don't want to go into profits of these insurance companies because some of them, some of the CEOs have been paid outrageous bonuses, and that has to come down. But if there's no room for profitability, how can a private insurance company compete against a public option? Third, premiums and financing the public option, the commissioner sets the rates at a level sufficient to fully finance the cost of health care provided in the public option plus administrative costs. In other words, the public option comes in a lot cheaper because not only are no taxes paid, but the rate is set by the administrator. And there's no way a private insurance company can compete with a government subsidized. And by the way, the rate that the public option pays is Medicare plus 5%. And you know the problem today, Medicare is set to go broke by 2017 because not only lack of payment in there, but the physicians that have a difficult time even meeting their bills because of the low reimbursement rate. Number 4, Sections 311 and 313, employer must offer a qualified health benefit plan to all employees. If an employee, listen to this, if an employee is covered by his or her spouse's plan, okay, let's say I work for you. Well, actually I do. Okay? You have, let's say a restaurant, because I was raised in a restaurant business, and you have 50 employees. And you say, Don, you know, we're gathering everybody together here, and I've got this plan, I've been working hard to get the rates down. And I say, could you give me your first name and Heather. And I say, Heather, you know, thanks, I appreciate that, you're a great employer, but Frida's working. I'm covered under her plan. There's no need for me to be on your plan. Heather, under this bill, you would still have to pay 8% of my salary into the health insurance exchange, even though you're not paying my health insurance and you're not giving me health insurance. And if I'm making $40,000 a year, you've got to pay $3,200 into the health insurance exchange. Not only with me, but all the other employers in the group, employees in the group that decide to go on their spouse's coverage. But look at this, Section 312, an employer must pay at least 71.5% of an individual's coverage and 65% of family coverage. But here's the kicker on it. It slips in. It says the employer must enroll an employee in the plan option with the lowest employee premium. So you've got this plan that's set up through a private insurance plan, Heather. You hire somebody new, and you are obligated to offer him the plan with the lowest employee premium. That plan is the public option because you can't compete with it. So that means all of your new employees go into the public option, and you reach a point and say, well, this is dumb. Why should I have 2 different types of health and accident insurance as an employer? I'm just going to go with the one that the employees are forced to go into it. And only the employee can opt out of the public option, which means that you can offer him a plan that's even better than that. And if for some reason he doesn't want to go along with it, you're still going to have dual plans that are competing in your business. And so why would an employer want to have that type of a situation where he's got 2 plans competing? Section 221 requires the Secretary Secretary to establish a government plan that is supposed to play by the same rules as private plans of the exchange. But the bill requires the government to set the benefits of all the plans. See, under the health insurance exchange, you could have up to 4 different types of plans. But each plan has to have exactly the same type of coverage. So you can't go to an insurance company and say, look, I want a $20,000 deductible. You know, I just want a house sale. That's the way health insurance used to be years ago when it was called major medical. You guys, the gray hair, remember that? And the purpose of major medical was you took care of your own day-to-day expenses. And the purpose of major medical was, God forbid, somebody should get a heart attack or cancer, and it would save their house. 7, Section 222, the public option in its reimbursement gets $2 billion initially from the U.S. Treasury to pay claims within 90 days, interest-free. Now, what private insurance company can compete on that basis? You just reach into the government till, you pay the claim, and you pay it back without interest. And then, Section 223 shelters the government-run plan from any administrative or judicial review of any payment or methodology it uses. You can't question the person who determines the nature and extent of the coverage. It's an appointed bureaucrat that does that. Congress can't question it. Doctors can't question it. Consumers can't question it. And the 9th reason why private plans would fail is that every private health insurance plan is taxed with money going into what's called comparative research. The money goes in there to do this comparative research, and that's where the issue of rationing comes in. Is how do you take a budget of this size, and how do you ration all the care? In fact, I think in your packet you may see what happened in Vancouver when British Columbia simply ran out of money and canceled 6,000 surgeries. So the board that makes that up in Canada, and the board that does that in England is called NICE, private insurance companies are taxed in order to keep that going. And so what happens when the private insurance company can no longer afford to stay in business, then you end up with the sole option being the government plan or the public option. Now, when Congress